we try to mend fences and come back together as a people. There's a question from a student in my diversity in media class about vaccines. Doctor, let's take a listen.
Hello, my name is Christian Moreno. I'm a public relations major at San Jose State, and I currently live in Torrance, California. My question for you, doctor, is when a COVID-19 vaccine is ready, how do you get the American people to trust in such a fast-track vaccine? And when do we know when this vaccine is safe and effective?
That is a great question that so many people are asking. I think we need to be honest and transparent and explain to the public what the process is of determining that a vaccine is safe and effective. It's been done very quickly, but the speed is a reflection of the extraordinary advances in scientific technology that allows you to go from the genetic sequence of a virus into what we call a vaccine platform. And within a period of literally days to weeks to get a vaccine that you could put in a phase 1 study in humans. We've done this the fastest that has ever been done in history. It's a reflection of two things. A, the scientific advances and the exquisite technologies. B, an enormous investment of financial resources on the part of the federal government to get these vaccine companies to take the product and put them into clinical trial. I must say, the public needs to understand that the decisions that were recently made last Monday and yesterday about 2 vaccines that have an extraordinary degree of efficacy, 94.5% in one and close to 95% in the other. The decision about that and getting the study to say it is now effective was made by an independent body, not beholden to the administration, not beholden to the company, not beholden to anyone. It was called a Data and Safety Monitoring Board of independent clinicians, vaccinologists, statisticians, ethicists, and others. They did it independently. They then take that data, present it to me, which they did on Sunday afternoon, just a couple of days ago, and then we went from there to the company and to the rest of other elements of the government. The data then go to the FDA, to career scientists who have no political obligation to anyone. Then they go to an independent advisory committee, which then looks at the data. And only then, when everyone agrees, does it get what's called an emergency use authorization to be administered to people. Now, what I think the general public doesn't understand, because quite frankly, and it's correct, you're observing it from out in the West Coast, but it is. There are mixed messages that come out. There's confusion. Who's saying what about what? But what really is happening is this independent process that is looked at by people with no skin in the game, financially or otherwise. I see the data. I get reported the data to me. The FDA sees the data. Soon it will be published where the entire community will see the data. And I can tell you, I'm confident that when the FDA approves those vaccines, and so far there's been 2 that have been really quite effective, efficacious, and there will be more, that I would, without hesitation, take the vaccine and suggest strongly to my family to also take the vaccine.
And I believe that's what the country's been wanting to hear. You heard one of my former students in Chicago say that as well. Doctor, we did something I hope you won't mind, but we swore your staff to secrecy because we have a little